Hi, I'm Reid, Executive Director of the National Lighting Bureau, and welcome to our Let's Talk About Light and Health series. This is a joint venture between Mount Sinai's Light and Health Research Center and the National Lighting Bureau. Today, I'm joined by Jennifer Brons, Research Program Director, Light and Health Research Center, Eric Jacobson, former President and CEO of the American Lighting Association, and Terry McGowan, the Director of Engineering and Technology at the American Lighting Association. The title of this session is Home is Where the Light Is, Residential Light Fixture Program. Now, sleep is important to people's health and well-being. This session will discuss a new program developed jointly by the LHRC and the ALA to help residential lighting customers identify and select fixtures that will help to improve their sleep. If you have a question during the discussion, please submit it using the Q&A button. Jen, let's start with you. You've worked as both a lighting researcher and a designer. Can you give us a quick overview how lighting can help sleep?
Yes, thanks, Randy. Now, there's two processes in our bodies that we're trying to align, the sleep-wake cycle and the light-dark cycle. There's something called homeostatic sleep drive, which is the need or pressure that builds up over the course of our day to go ahead and sleep. And when we do sleep, it releases that pressure. So that's one mechanism. There are many biological functions in our body that operate differently by day than by night. There's how we process food, our core body temperature, cellular repair, memory consolidation, flushing of toxins from the brain and body. If the timing of those biological functions are not orchestrated properly, and if that goes on for years and years and years, research shows that it contributes to illness such as metabolic syndromes like diabetes, dementia, and cancer. So there's a region of the brain that is like a kind of orchestra conductor with a wand or a clock that is ordering our body systems to perform their functions. And that part of our brain clock, it has a clock a little longer than 24 hours. So if it doesn't see a regular light pulse every day, it will tend to drift later and later until it becomes out of sync with our sleep-wake cycle. So with circadian entrainment, we think of it as a healthy lifestyle, much like diet and exercise, something we need regularly, a bright pulse of light in the morning and lower light levels in the evening. And that's why we think bright light every day can help with our sleep. We at the Light and Health Research Center think our homes are a great place for getting that boost of light in the morning and then conversely dim levels in the evening.
Okay, thank you, Jen. Eric, for many years as president of the ALA, you've had a unique vantage point on residential lighting trends. What were your thoughts when you were approached about improving sleep with residential lighting?
To be honest, I was really very excited about it. As a individual that had poor sleeping habits myself, and have also seen my mother-in-law really decline rapidly with dementia through really significantly poor sleep patterns. It was really personal, for me. And I really thought that ALA could really have an opportunity to raise the consumer awareness to another level of this issue. I know ALA had for years had performed and conducted educational sessions related to circadian lighting, with many of that from the Light and Health Research Center's participation and through Terry's leadership at ALA. But, I thought we could do more than just educate, and there was a huge opportunity to really develop, products. So I was just super excited about the opportunity and thought that we could really make a difference in the world.
Okay. Well, Terry, you've had many roles in your long career in the lighting industry. Tell us how you came to be interested in circadian effective lighting.
Well, I think it goes back to about 2002, 2003, when we first started to look at research that had been done on light and health. This was research that had accumulated a few years previous. I organized one of the first research meetings so we could review this research, talk about it. And at that point, Dr. Mark Ray, who's head of the Light and Health Research Center, of course, came up with one sentence that really changed the world. And he said, lighting is not just for vision anymore. And that set us on this path, because when you say that, what do you really mean? And I think what we have found now is that light can affect health. I call it quality lighting, because we get quality lighting from nature, sunshine and clouds and rain and everything else, but the lighting part of it is essential for our health. And the further we get away from it, logically, the more unhealthy it is. So how can we bring it back? And since we live in an electrical world, we do things from morning to night that kind of gets in the way of good lighting. It's really a question of lighting quality, how we get that back. And so when we started to talk about it, and Jen made that point just a few minutes ago, at the beginning and end of the day, we're typically home. That's a good time to bring it in. And so when I started talking to Eric about it and other members of ALA, they said, well, sure, that makes sense. We've got to do something. We've got to make sure we have products that can provide that bright light at the right time and the dim light at the right time, and tell people how to use them.
Okay. Eric, you and Terry started collaborating, I understand, about a year ago with different manufacturers at the LA. What kind of questions and what kind of feedback did you get from those manufacturers?
Well, just in general, I believe that the industry, because of our education, understood the connection between light and sleep. But I think for many, that's where it ended. You know, they knew there was connection, and how do we, what do we do from here, and how do we change that in our products and how we go to market. But although we did have some manufacturers that were very active, already developing products in this space. But I think what mattered most when Terry and I talked about it was that the Light and Health Research Center really is the authority on light and health research. So if we were going to partner and really try to develop a program with manufacturers, that we needed to partner somebody that really had the expertise and the credibility to carry a program forward. So when Terry and I went to the manufacturers, and really it came about raising funds. It's always about raising money, unfortunately, but we had to make sure that, on the credibility side, it was there. And when that was there, I think with our leading manufacturers, it became much easier to raise those funds because the general interest was there. And it's just, how do we bring it all together? I mean, I'm going to leave it to Terry to talk about, what's happened since I've retired, there. But I think there was overall enthusiasm. The connection was understood, and really, how do we really drive a program, create new products so that there is actually something to purchase when consumers go to a store, and really understand that there's products available to meet their needs. So,
Terry?
Well, yeah, and that's right. We got a good start. We got quite a few manufacturers interested, and then of course we teamed up with the Light and Health Research Center, so they were giving reports to the manufacturers as they came up with new luminaire designs, and whether these designs were appropriate or hard to work with or needed to be used in tandem with others. We got a good sense of what the luminaires could do, so the manufacturers had some guidance on what to go forward with to put products on the market that really made sense for homeowners. And this whole idea of getting enough light at the right time involves more than luminaires, of course. It involves the light source, and maybe it involves controls. Yes, you can do it without controls, but controls make it kind of automatic, so you can set it, forget it, that kind of thing. So it was really more than the luminaire itself, and I'm glad to say we have manufacturers involved who are also involved with controls and setting up brightness patterns for the day and evening, and also the light source itself for the screw-in types of luminaires that are still very common in residential applications. So this has been a very broad and appealing program for our ALA members, and they are excited, quite frankly, because traditionally residential lighting has really been focused on two things: lighting to look at and lighting to see by.
Right.
This expands those functions. It raises the value of residential lighting. That's a key factor. It makes it more valuable to the user. It does more than let you see or look nice. And that's important too, because today value for anything that you want to buy is better if it's higher and better than it has been before.
Sure. So, Jen, to Terry's point, it's always a challenge to translate research into practice. What has the LHRC done to bring circadian effective lighting into the residential lighting field?
Well, Randy, for years we've been doing field studies with the National Institutes of Health and in the commercial sector as well, and the U.S. General Services Administration, the U.S. Navy. Usually we have to kludge together, as we were just hearing, technologies, lighting technologies, diffusers, controls that don't always look elegant and attractive and aren't always easy to use. But even so, our participants in our studies don't always want us to take away the light that we've had lent to them for the study, and are asking us, well, where can we buy something? So as Eric was mentioning, what's great about the program that ALA is developing is that it will be a place where we could refer people to products that have been tested, have undergone some design to make sure that they provide those highlight levels during the day and the low levels in the evening. So that's why we approached ALA, and we're thrilled to be working with them to help people find products that have the needs and that are also stylish and comfortable for our homes.
Sure. So, Eric, I want to come back to a point you made. You talked about raising money from these manufacturers. Okay, you raised that money, and then how did you envision the program operating?
Well, I think, when we went to raise money, I think first and foremost, when an organization like ours or yours, leadership was really the key attribute in the beginning. Like, we had to take a leadership role for the industry, and sometimes that's not easy. And there's, naysayers along the way that may not understand, the overall goal. But I think our goal was to benefit the lighting industry and ultimately benefit, their customers, and really developing programs that could help them sleep better and feel better. And so with that, I think the first step was product development. We had to get these manufacturers kind of understanding what the characteristics were, developed by the LHRC to develop products that met that criteria. So product development was key first. Without products, none of this is possible to do it in a residential space. So that was goal number one. And then goal number two was really about education. Everything about education. How do we educate our member on the significance of the research and the products that are coming out so that it could be used for their customers? And then how do we transform that into the lighting showroom? How do we make the showroom more valuable in the expertise that they're offering back to their customers, creating potentially hang tags for the products, ALA, better light, better sleep, hang tags that really they could direct their customers to. And I think the most unique thing about this is that there's not one prescriptive approach. I mean, everybody wakes up different. Everybody has a different morning routine. So ultimately, what it does for the retailer is really work one-on-one with their clients to develop a program to making sure that they're getting the proper light input into their eyes in the morning in the spaces where they are. So, that's where I envision it, all the way going to the end consumer, really a one-on-one approach that goes back and meets, all the characteristics that the LHRC had in their research. So
let me just open this to either of the three of you. Where's the program now?
I think I can answer that. Well, ALA embraced this program, as Eric suggested, but it has continued after he retired, and our current leader, Larry Locke, has picked it up, run with it, and we're still developing it. We formed a marketing committee so that we can understand what the aspects are of getting these kinds of products into the market and getting them used. We've included our showroom members because they're going to be key. That has to be through education, of course, and understanding, getting ready to answer questions, getting product out there. And of course, there are surprises along the way. For example, how many existing lighting products can serve as better light, better sleep products? Well, quite a few, as it turns out. And as Jen hinted at a few moments ago, she found some existing products that perform very well. And what about products in combination? Is it good enough to have lights on the ceiling or a table lamp maybe? But maybe it works better with combinations of products. We'll be getting into that kind of thing. So we're not only into the product development, but we're into the application and education aspects of it. And this is going to be a key factor going into the future.
Hey, I want to come back to education because I do think that's key, but I still want to better understand. Better light, better sleep is the name. We're going to have hang tags. They're going to be in the showrooms. But what is the criteria for a fixture? And is it the fixture that meets it, or is it the fixture and the application that meets it?
Jen is the expert.
Yeah, Jen.
Well, that is something we were working with all the manufacturers on. Each manufacturer knows how their product is being used in their customers' homes. So they develop a certain geometry relationship to essentially get at the application of their product. How far away is their product typically from their customer? And then we test how much light they would have at their eye at that geometric relationship of the use case that the manufacturer explains. And we were able to show that they meet a certain light level at the full output during the morning, and then they're able to dim to a lower level in the evening. And in addition to the quantity of light at the certain geometry that the manufacturer established, we also limit how essentially bright the fixture is by limiting the luminance of the source. So that was actually more challenging for the manufacturers than being able to figure out what illuminances they would get from their calculations. Many of the manufacturers did not know what luminance was or did not have a luminance meter. So we did spend some time meeting with each of the participating manufacturers to explain the criteria, how they could continually develop products on their own without our hand holding. And then we did verify for each of their products how well they performed with those criteria.
So it has to have some sort of control to lower the light level, whether that's manual or automatic.
Right.
Okay.
Right. Some of the products were controlled by a smartphone app, and some would need to be assembled with sort of a scene controller that has a time clock with it. And some are portable type products that have switches built right in to them, or dimmers built right into them. So they would have some sort of thing saying, push this button at night, push this button on during the day. So there's really a range of approaches to how controls are incorporated into the ALA products that are part of this program.
So it sounds to me like it is centered around luminaires, but Terry, I thought I heard you say something about a screw-in bulb or a screw-in base. So can it be bulbs as well, lamps?
Yes, it can. And of course, there's two kinds of fixtures for residential use, and we're going through this whole business now, saying, okay, which ones are fit for a particular application? And those two types are the screw-in types, the socketed fixtures. The other type now with LEDs is the integrated fixture. So there, you don't have a choice of changing light bulbs, but so many fixtures in the home are socketed. They will remain so. There are new fixtures being developed with sockets, so they will continue to be available. So light bulbs are a natural. We have to have light bulbs that provide enough light, of the right spectral composition, of the right use for the time of day. Dimmability is important. All of these things are key factors in this whole thing. And of course, that means light bulbs have to be there. The light bulb is not disappearing.
Okay, thank you for that education. And again, you said you got involved in this around 2002. Can you tell us about the historical precedent to the program?
Yeah, this is something that goes back well beyond that 2002 point. It's 25, 30 years of research that hinted at how people's lives were affected by light. The invention of electric lighting, of course, set that off, and there's been questions about it ever since. Even when you come to things like glare, what is glare? We don't have a measure for glare yet. And yet we know it when we see it. Everybody's a glare expert. So it's the same thing here. What's the best light for us during the day? And the answer, of course, is what nature has provided, because we've got a lot of experience with that as human beings. So the more we can duplicate that and do it on some kind of a schedule that fits our lives, the more positive that will be in terms of quality of life. And we hope a better sleep is just one of those factors. Maybe there's more. There's certainly a lot of research going on right now that's digging into that. But we're not in the medical business, we're in the lighting business. And so it's important that we say, I think, that this is really quality lighting. It's something that aids the life that we lead, the situation that we have, and makes it better.
There's
Jen,
precedent in the lighting industry for focusing on quality lighting in our residences. Back in the early 20th century, the IES developed a program called the Better Light, Better Sight program that I know Terry ran into a lot of the charming documentation for the testing that was required for that program and the outreach that was done at that time.
so let's talk about testing, Jen. I assume the LHRC will test these fixtures, and then do you certify them? Is that how it works?
There actually won't be a certification program. It's important to the manufacturers that they're able to test their own products and to list what kind of conditions, the use case under which they've tested their products. So there won't be a certification label that's we don't expect. And I think Terry will go forward in the future as the committee develops all the requirements. But I think that it will be self-certification with some testing, spot testing here and there. But our role is at the Light and Health Research Center is to help start the program and get it rolling. But we anticipate that it's going to be an ongoing program with the ALA.
Well, I will tell you my personal, I like that. Let's not make it difficult. Let's let the manufacturers do it, but let's do trust but verify. And I hope you do spot check and make sure that everyone is, playing on an even on a level playing field.
The ALA manufacturers are the most qualified to develop these kind of products, both from their expertise internally, but Jen said it. We want beautiful products. We want products that people would, not only live better by, but feel good about having them in their home. So I think that's a really important fact, that we don't want, some industrial looking lighting product that people don't want to buy and, to be in their house. We want it to be decorative. We want it to be beautiful and also meet the needs of the program.
Eric, how many ALA manufacturers are there?
Well, again, I'm stepping out of my bounds a little bit right now, but we have about 120 manufacturers that are really produce about, I'd say 90% of all residential lighting fixtures in the U.S. And Canada, excuse me.
Oh, a pretty broad reach, to say the least. So Jen, just kind of wrapping up, what do you hope to see as a result? What would the end game of this be?
Well, we'd love to see more products that are available that are designed to provide those high light levels in the day and low light levels in the evening, but that are also attractive and fit into our homes and give you a range of options depending on what your lifestyle is compared to the next person's house. And ultimately, we like people to use that as part of an overall healthy lifestyle, much like diet and exercise, and therefore to help people to sleep better at night and improve their health.
Terry, closing comments?
Well, I think it's one of those things that could really expand into a much broader way to look at residential lighting. I mean, as I said, it's lighting quality, and there are other ways to achieve lighting quality, and an infinite number of ways to make a space, a room, a setting more interesting, more visual, more fun to be in, healthier, better sleep, all of those things. So we're right on the edge here of entering that new realm. And it's a wonderful thing. And I'm so glad the ALA is developing and supporting it. And it's going to involve other things too. It'll involve home decor. Certainly it'll involve shading and curtains, because they let light into space too. So there's other parts of the residence here that we have to be sure from a lighting standpoint that we integrate with. So this is the beginning of something. And we're not quite sure yet where it will go, how it will be, but we know that ALA will support it on behalf of our manufacturers and our showrooms because it's the way people live. And we're all for quality of life. And we think lighting has a major part to play in that, and we want to be right there with it.
No doubt. Jen, closing comment?
We're really looking forward to seeing all the innovative techniques and solutions that the ALA manufacturers have come up with. We were impressed by the products that they showed us in their first round, and we're looking forward to being able to refer people to this program and put more light in their homes.
All right. Very good. Eric, closing comment?
Yeah, just pleased to be here, Randy. And I appreciate you just bringing this subject and addressing it, in your formats and in your audiences, because I think it's a really growing opportunity. As we know, we have a generation, that's growing with elderly that are, I think, and dementia is a key factor of what's happening because of, I think, poor sleeping habits that basically lead back to poor lighting habits. So I think one of the things, I'm a very simplistic guy, and you think back when you're a kid and all the people that in farmers that you knew that worked up, that got up early and were out in the sun and came in at night. I never remember hearing anything about bad sleeping patterns or bad sleep. They all slept. And, with the very unique workplace that we live in today and many different workplace schedules, it really drives home that this program could make some significant impact on the way people feel and the way people sleep. So,
and we will now open the floor for questions. Thank you. I would like to introduce Allison Anderson, who is a producer of Let's Talk About Light and Health. She's the one that works behind the scenes to put all these together. And Allison will be monitoring the Q&As. Is this similar to a medical prescription with light?
And the answer is not really. I think in the video we mentioned the idea of lighting quality a couple of times. This is really going back to our roots, the way human beings were designed and evolved to have bright days and dark or dim nights. So we're trying to bring back reality as far as the body is concerned, so that it knows what to do. And we're part of living things. This goes beyond people. It's plants and animals, the environment. We're all beginning to understand that light, when it isn't expected or needed, is probably worse than light at other times. And we have to understand that if we're going to make sense out of our world today.
Yeah, and I'll add to that no, I think it's very important. And obviously that was it wasn't an issue and a concern that was discussed by some of our manufacturers, concerned about, various claims that could be made. And I think, so we're not, the program won't make any claims about, that it's, you will live longer or you won't get cancer or anything like that. But I think we'll say in more general terms that better light, better sleep, you'll feel better. And that's, I think, where our focus will go. We certainly don't want to get into any liability issues, related that could arise from claims that would make you live longer. And so the program definitely won't do that for sure.
Is it just lower light in the evening, or should the color temperature of the light be different morning to evening?
Although it could be a little different with color, what we're finding in the research is that the main thing that's important is the quantity of light by time of day. So although there are products that can shift color in the evening, it's okay if you stick with one color temperature and just dim it. That is the primary aspect of our lighting that's important to in training our systems. But yeah, several of the products that we tested have the ability to shift color by time of day. About half, and the other half were just a static white color. And what we use in our research tends to be a static white color. When we go into people's homes and put lights temporarily in their homes, we usually just use a warm white color around 3000 K. And people have not complained about the color of the light when we put them in their homes. In fact, they keep asking to buy them.
Sure. Thanks very much. It was really wonderful. And Jen will be familiar with what my questions tend to be. It's around assisted living facilities. So I got all the administrators in assisted living facility get very, very excited about providing circadian effective lighting at breakfast and at lunch, because essentially folks are only getting about 30 minutes outside of lighting per day. Much to my dismay, when I started looking around, I am finding exactly what you're talking about in terms of limitations about what I can realistically opt for them. What I've come up with is essentially rechargeable light bulbs, so to speak, along with some daylighting in the existing LED, which is a very, very high ceiling. And I'm wondering if you have any other suggestions. The caveats for me are really that I'm putting it on basically breakfast and lunch, so I can't have cords running all around all the assisted living facility, or else falls would be another problem I end up with.
Yeah, that's a big challenge, trying to get power distribution if these are places where there are many people congregating and so forth. Allison and I are doing a design project right now with the same challenge of power distribution. So what's nice about the residences, the individual residences, if people are still living at home, is they can feed wires through and have things turn on for them at the time of day they need it, and have it dimmed down when it's not necessary. But in terms of congregating a lot of people together, it does seem like the major challenge is how are you going to get that light close to people and not make it a trip hazard. So there was one manufacturer that are working on a pendant light fixture with a large diffuser, so you don't have all the light coming from a tiny little area. It's spread out over a wide area and coming from overhead, but not so far overhead that it's really far away from them. It'll be kind of closer to people. So we hope to see more kind of dining room options as this program continues.
Okay, very good. Thank you. Kathy has a second question, and I'll just read it. Any thoughts of a certification for contractors and interior designers that would move these changes forward and get the word out to the public faster?
I think we'll see maybe certification in commercial industrial lighting first. We'll see how that goes. That raises the cost of lighting. And so we have to be careful what certification means. Plus, what we're talking about here is an environment. It's not just a light fixture or a light bulb or a control that should be certified, because it's so dependent upon how people use that light and where they sit and time of day and all of those other things. And the light sources can include daylight, of course. So curtains are part of it, and windows and window area and everything. It's more of a design situation than it is a product situation, but we certainly need the products that are capable of providing abundant illumination and the controls to help time that so it's done at the right time, bright days and dark nights again. So I don't see certification coming along for homes anytime soon, as Eric has suggested. But if there are places where people sit in offices all day and where things are fairly static, and they want to certify that kind of situation, well, okay, certification has some value.
Yeah, I'll go ahead and address just the certification of products themselves. As we talked to the code writing companies like UL and CSA Group as far as certifying the products. But so they knew of the effort. We briefed them that when we were moving this program along, but we certainly made a decision to try to, I think, as Randy said, to keep it as simple as possible, that was self-certifying from the product standpoint, that at least, at this point, we would not get UL or CSA Group involved in our program. Now, they have the ability to do what they want moving forward related to their own programs. And, we'll see as this grows, what they'll do individually. But with this product, we don't see it. We want to keep the cost down for the manufacturer. So therefore, we can really spend the money on the products and get the products out in the marketplace.
Okay, here's more from Kathy. I'm in a program for people involved in making lighting recommendations. So I think she's talking about maybe the lighting designer being certified in this circadian technology. Do you ever see that?
That could easily be added. Certifications and ability to design for circadian lighting applications, certainly something we could do as ALA. And in fact, we've already had new program packages put in place. We've had webinars on this for our members, so that we are teaching a very substantial amount of information is flowing on the subject of how this works, where you use it, what it should be doing, and so forth. So certification is certainly a possibility there.
Well, and I just want to add, ALA really is one of the authorities on lighting education. And so although we'll determine whether it'll be an individual certification, we have our certified lighting consultant program and our residential lighting training course. Both of those, or the residential lighting training course is a stair step to the certification program. So I see this being added into that curriculum along the way. So it'll be interesting to see if individual certification would ever arise, but certainly incorporated into our training, into our certification programs for sure.
I've got one question for you, Eric. I'm in Nashville. When do you think I will see hang tags in my local showrooms here in town?
Well, that may be a better question for Terry, since I'm not on that committee. So that I think that I don't want to answer that incorrectly. Terry, I'm gonna punt just because you're engaged in that committee today, and I know that's just formed. So I'll let you answer that question.
Well, it's a great question, Randy. How soon can we start seeing these products? And the answer is, I don't know. There are some out there already and very quietly being used for seeing how people respond. We don't want to sell something that people don't want to buy for various reasons. So, I guess you'd call it the testing phase. And what kind of certification or recognition, maybe is a better word, should we put? A hang tag? Kind of old-fashioned. Maybe there's something else that we could use, some way that people could understand that this lighting fixture, this light bulb, this control has got something special in its capability list, and do it that way. So that's what that committee, marketing committee, is thinking about, and we're excited about it. It's going to hit certainly in the next few months or so. There'll be products out there. The market will start to feel its way to see what we need to make it a real interesting and useful product as far as consumers are concerned. So it's an exciting time, but keep watching because you'll see some surprising things.
Okay, well, we will wrap up here, and I would just want to thank you guys because this is something that is really needed in our industry. And we're so happy to see the LHRC and ALA to kind of take the lead on this. And hopefully we will begin to see these hang tags everyone. Okay?
Thank you very much. Appreciate it, Randy.
Yep. Thank you all.